And we're back to Public Affairs on Peach. April is Autism Awareness Month, and this morning we are taking a look at autism and what an autism diagnosis means for children and for parents. Joining me now is Dr. Alice Schillingsberg. She's a licensed psychologist, behaviorist, and program manager of the Language and Learning Clinic with the Marcus Autism Center at Children's Healthcare of Atlanta. Thanks so much for being with me. That is a long title to get out in one breath.
Thank you for having me.
Sure. How do you recognize the signs? If a parent is out there and they think something might be amiss, what are some of those first signs that a parent should look out for?
Sure. I think sometimes people think that the first signs are a lack of communication, but since communication often doesn't develop until 2 years or so, sometimes that can be a little bit late. And there are some earlier signs, specifically in social relatedness or social reciprocity. So some things early on that you might notice is potentially a lack of eye contact or sharing enjoyment with your child. Your child might not be sharing things with you, showing you things, pointing things out, using gestures appropriately. Some of those things might be early signs.
I hear from what I understand from research that I've done previously that children will develop normally, and then perhaps parents will notice that they're not doing something that they had been doing before.
Yeah, that does sometimes get reported, and it's not clear whether or not that is happening, or potentially those skills that they're reporting have maybe regressed, weren't as consistently happening to begin with, but that is sometimes commonly reported.
So when you're able to diagnose it early, how effective can that early intervention be?
It's absolutely crucial to get an early diagnosis. Research and treatment is certainly still emerging, but we do know quite a bit about the effectiveness of interventions that are available, specifically behaviorally based interventions. The field of applied behavior analysis and ABA has a long-standing history of research that shows that it can be very effective to intervene early and really specifically focus on social skills and social relatedness, early communication skills, and then certainly to address some of the challenging behaviors or problem behaviors that sometimes emerge when you can't communicate.
Yeah, I mean, you probably just addressed this, but once you get that diagnosis, how do you treat that? What are the steps there?
That's a great question. I know that when you do get a diagnosis of autism, it can be very overwhelming, and in the field of autism, there are, I would guess, probably hundreds of options for parents, and I think it's really important that parents are asking the right questions, asking for what's the evidence associated with this particular route of intervention, and really trying to make some informed decisions, working very closely with a provider to make sure that they're spending their resources with the interventions that actually have science to back up the effectiveness, and not it can be very overwhelming because, when you go on the internet, you're going to find lots of different options. But I think first and foremost is working with a behavioral psychologist who can get your child into some early behaviorally based interventions.
Social skills, one of the things that autistic children have trouble with. How do you help improve those social skills?
That's a great question. I think one of the things that we know about kids with autism is that their motivation sometimes to interact with others is impaired and sometimes completely lacking. And so social skills intervention really wants to work on teaching kids that interacting with others is fun, and really working on their motivation so that they're finding sort of natural enjoyment and natural reinforcement for interacting with others, and teaching them the value of interacting with others. And that can be some of the first foundational steps to working on things like maintaining a conversation and asking people questions, sharing things with others. But sometimes you have to start very basic and work your way toward those things.
And along the same lines, how do you help improve those functions that children may not be able to do?
That's another good question. I mean, an associated feature of autism is delays in some functional skills, certainly adaptive skills like toileting and basic hygiene kinds of things, and interventions can be specifically designed to address that, and teaching kids more independent skills that they need sort of on a daily basis.
Just constant repetition
Yes. One thing that we do know is that intervention does need to be fairly intensive, and often it's ongoing. It would be common for a child to receive 10, 20, 30 hours a week of intervention and specialized services for 2 to 4 years even to really make some important, significant gains.
Well, the good news is that all of that research that we've done previously, or you've all done previously, it seems to be paying off with this early intervention.
Absolutely.
All right, Dr. Chillingsburg, thanks so much for joining us this morning. Now, coming up, how a parent deals with autism diagnoses for their child. Hear from two parents who are dealing with the disorder and the treatment.